Hello, my name is Shanika Hampton, and this is my Week 7 assessment of movement dysfunction for a subject of my Doctor of Athletic Training program at A.T. Still University. For the terms of this movement assessment, I felt the need to do a brief posture assessment that would help allude to some of the indicators for dysfunctional movement assessment to take place. Assessing the posture from the inferior to superior aspects of the body, we can actually see that the anterior view displays a mildly pronated foot that is actually evident bilaterally. You can also see increased external rotation at the hip and leg joints. This is consistent with the posterior views in the same plane. And this is all happening more on the right side where the same arrow is located. Now, from these same views, anteriorly, the pelvic position is showing a slight upslip that is evident here. And you're also able to see this from the posterior view, where you can see not only a shortened distance from the spine to the right PSIS, but going back to the front, you can see an outward flare, all on that right side. What's not as visible due to the subject's resting arm position is the slight posterior rotation of the pelvis. You can actually see here that the gluteal tone is a little bit diminished, but more so on the left than on the right. What will be interesting to monitor during these movement assessment tests is actually how the patient performs hip abduction and extension on the left side. There is more evident muscle tone on the full right side of the body as you look upward. I can actually see that consistent with shoulder elevation on the right. And we can see that both in the anterior view and the posterior view. I can also see that there is a little bit of scapular protraction and winging, which is more evident actually on the left side of the body. And you can also see that presenting here with that mild kyphotic rounded posture of the torso. The patient and subject also tends to rest his head with an extended posture, which we can see from this view here. And we can also see the same consistent tilting to the left side. So that'll be interesting to see what he looks like on that cervical flexion test. You can also see an evident increased angle between the chin and the chest that is greater than 90 degrees. So this subject is a person who demonstrates high indication for assessment of movement dysfunction. So we'll be performing a series of 6 different tests. One will be hip extension, hip abduction, a trunk curl up, shoulder abduction, cervical flexion, and a push-up. The following videos that you will see are not in any one particular order. It was just what was most convenient to assess for the patient. Do I have your permission to share this video in my online DAT course, Assessment of Movement Dysfunction? Okay, the first
movement that I'm going to have you do is a prone lying hip extension. So what I need for you to do is to lie face down on the table with your arms, both of them to your side. Okay. All right. And for the terms of this video, I'm going to have you do both sides. Just do a very slow lift and come down. And you're going to do this once on the right side and once on the left. All right. You may lift your right side. Come down. And 2 more times. All right, now we're looking at the left side. So if you can do the same motion, lifting your leg slowly 3 times.
Thank you.
Thank you. Okay, from this view, I'm going to be having you lift your right leg toward the sky into hip abduction. Again, you're going to do these motions same 3 times slowly. And you may start at your convenience. And thank you on that side. And if you can actually switch to your head at the other end, back still facing me. And then again, you may start at your convenience, 3 times, slow lift. And if you can try those same 3 lifts for me just again for your left side, your left leg, go ahead. Okay, go ahead and try one more time, 3 times for your right leg and hip abduction. Thank you. Okay, so for this next view, we are going to do a trunk curl up. That's going to be me holding your heels just for support and base. And then you're going to do a small curl up, almost very similar to a sit-up or a crunch, only just to lift your shoulders off of the table. So not a full sit-up, but just enough just to lift you off. Same trunk curl up 3 times for me, okay? All right, at your discretion, go ahead. Thank you. Cervical flexion test. All I'm gonna have you do is try to touch your chin, to your chest. And we're gonna do that same motion 3 times. And you can start at your discretion. It's nice and slow.
Thank you, sir.
Okay, thank you, sir. Okay, sir, for the terms of this video, I'm going to have you do what's called shoulder abduction. So what that means is that you are going to have your arms bent to a 90-degree angle, or basically your elbows are flexed. And then you're going to slowly lift both arms up and away from your body. Does that make sense? All right, so you're going to do that 3 times at your discretion. All right, thank you very much. Okay, sir, for the terms of this video view, I'm going to have you do a push-up position. So all I'm going to have you do is place your hands to your side. Like you're going to do a push-up. You're going to do 3 push-ups as best as you can, slow at your discretion. Whenever you're ready to start, you may begin. Thank you. And we're going to change the view. All right, sir, from this view, you're going to do your same 3 push-ups nice and slow, and you can start at your discretion. Thank you, sir.
So as you can see with these videos, there were a lot of different angles that presented with different dysfunctions that we will address upon review of this in our assessment paper for discussion. Thank you for watching. Have a good evening.